Welcome to Thera Talks with Dr. Shrestha. We are going to discuss on understanding extravasation, causes, effects, and preventive strategies in intravenous medication administration. Extravasation indeed refers to the unintended leakage of fluids, such as drugs or other substances, from a blood vessel into the surrounding tissues. This can occur during the administration of intravenous medications or fluids. Its frequency in adults ranges from 0.1% to 6%. Extravasation can cause damage to the surrounding tissues, leading to various symptoms and signs. The common indicators of extravasation include pain. Patients may experience localized pain at the injection site. Stinging or burning sensations. Sensations of stinging or burning may be reported by individuals experiencing extravasation. Edema. Swelling or edema around the injection site may occur due to fluid accumulation in the surrounding tissues. In more severe cases, extravasation can lead to tissue dysfunction and physical defects. This can result in complications such as tissue necrosis. The leaked substance can cause damage to the tissues, leading to necrosis or tissue death. Scarring. Healing from the damage may result in the formation of scar tissue in the affected area. Functional impairment. Depending on the extent of the damage, there may be a loss of function in the affected area. Delayed treatment. The need to address the consequences of extravasation can lead to delays in the administration of necessary treatments. Psychological impact. Patients may experience anxiety, distrust, or fear of medical procedures due to the negative experience associated with extravasation. Assessing the severity of an extravasation event and determining suitable interventions relies on the categorization of extravasated drugs. Extravasated drugs are categorized into three main classes: vesicant, irritant, and non-vesicant, which is based on their potential to cause harm. Vesicant drug. It is a type of medication that has the potential to cause severe damage to tissues if it leaks or extravasates from the blood vessel into the surrounding tissue during administration. Vesicant drugs are associated with a high risk of causing blistering, tissue necrosis, cell death, and other serious injuries. These drugs are often administered intravenously, and the potential harm is not due to the drug's inherent chemical properties but rather its concentration or formulation. Vesicant drugs can cause irritation and damage to the blood vessels and surrounding tissues if they come into direct contact with them. Examples include calcium chloride, dopamine, dextrose over 10%, mannitol 10% to 20%, phenytoin, vancomycin, acyclovir, vasopressin, epinephrine, lorazepam, sodium bicarbonate, and dobutamine. Irritant drugs. Irritant drugs are medications that, when they come into contact with tissues surrounding the injection site, can irritate. This irritation is usually due to the drug's chemical properties and its impact on local blood vessels and tissues. When irritant drugs extravasate, they may cause local reactions such as redness, swelling, and pain. The severity of these effects can vary depending on the specific drug and its concentration. Examples include azithromycin, clindamycin, ciprofloxacin, ceftriaxone, doxycycline, levofloxacin, metronidazole, piperacillin, potassium chloride, polymyxin, meropenem, and ondansetron. Non-vesicant drugs. Non-vesicant drugs are those that have a lower risk of causing significant tissue damage if extravasation occurs. These drugs are generally considered safer in terms of their potential to cause irritation and injury to the surrounding tissues. It's important to note that while non-vesicant drugs have a lower risk, any extravasation event requires prompt attention and proper management to minimize potential complications. Examples of non-vesicant drugs include normal saline, ringer lactate, furosemide, and steroid. Thank you for tuning in to watch the videos. Stay connected to learn about the risk factors, management, and prevention strategies associated with extravasation.